Tonight, North Carolina saw a steep decline in overdose deaths last year. We told you about that back in December. Certainly encouraging news. But those numbers aren't distributed evenly among North Carolinians. And tonight, Mecklenburg County public health officials are sounding the alarm after seeing a 200% rise in overdose deaths among Black and Hispanic residents in the county since 2019. Compare that to just a 14% rise among white residents during that same time. Now, keep in mind, Black neighbors only make up about 30% of the county's total population, and that number is 15% for the Hispanic community. So this is a disparity the county calls alarming, and it's happening all across the country.
If we do not address the disparities, we're leaving out a whole section of folks that aren't getting the proper help.
Now, here in Mecklenburg County, the Public Health Department says overdose deaths among all residents, largely due to fentanyl being mixed in with other street drugs like cocaine and counterfeit pills. Those pills are made to look like real prescriptions like Percocet or Xanax. And just 2 milligrams of fentanyl is enough to kill someone. Look at that amount in comparison there to the size of the quarter on your screen. Mecklenburg County Public Health Director Dr. Raynard Washington says he's first encouraging everyone to avoid buying and sharing those drugs. That's obvious. But he's also urging people to make sure they have naloxone, usually sold as Narcan, if they or someone they know is dealing with opioid dependence. Medic leaves naloxone kits with patients and bystanders on overdose-related responses throughout the county. But bridging the gap between neighbors goes beyond just having Narcan available. It's also about getting that message out that help is there and it's available. One program, for example, in Detroit, brings treatment options right to people in underserved communities with a mobile opioid treatment unit. That's important because advocates across the country say there is a lack of representation in Black and Hispanic communities, and they're not seeing what's available to them.
And I think one of the most important things is being consistent, building rapport with our relationships, meeting them where they are most comfortable. We're going to the patients.
But there's a deeper issue than just having that access to help. There's a cultural divide that could stop Black and Hispanic residents from seeking it out in the first place.
It's very hard for African Americans, Hispanic folks to come to white people and ask for help because that has never been our history.
Now, we did reach out to the local public health department to find out what they're doing to get resources into Black and Hispanic communities right here in Charlotte. They tell us they work with community partners serving Black and Hispanic residents in zip codes where there are higher overdose rates. In the meantime, if you or someone you know needs Narcan, you can get it for free. See the website here. It's health.mecnc.gov. Coming up next here on Your Side.